The muscles of the mouth, these are the important ones to remember, are the buccinator muscle, that's the thin, flat muscle of the cheek between the upper and lower jaw that compresses the cheek and between the lips. The depressor labii inferioris muscle, and it's also known as the quadratus labii inferius, a muscle surrounding the lower lip, lowers the lip and draws it to one side, expressing sarcasm. I'm sure we'll get the eye roll one of these days. Okay, and the levitator anguli oris, also known as the caneus. It's a muscle that raises the angle of the mouth and draws it inward. The levitator labii superioris, guess what it does? It's also known as the quadratus labii superioris, a muscle surrounding the upper lip that elevates the upper lip and dilates the nostrils, as in expressing distaste. I have a lot of facial expressions. Okay, the mentalis muscle that elevates the lower lip and raises and wrinkles the skin of the chin. The Orbicularis oris muscle, it's a flat band around the upper and lower lip that compresses, contracts, puckers, and wrinkles the lips. Expands, contracts, and wrinkles the lower lips, or wrinkles the lips. Now it's around here. Okay, the risorius is the muscle of the mouth that draws the corner of the mouth out and back, as in grinning. Okay, the triangularis, it's a muscle extending alongside the chin that pulls down the corner of the mouth. Which one is that now that wrinkles the eyebrows? That is the corrugator muscle. So you're using your corrugator muscle when you do this, and your triangularis when you do this. Remember that. There will be a test. Okay, the zygomaticus. The zygomaticus major and minor muscles extending from the zygomatic bones to the angle of the mouth, elevating the lip, as in laughing. Alright, now we're moving from the muscles of the face to the muscles that attach the arms to the body. Okay, there is the Latissimus Dorsi, a broad, flat, superficial muscle covering the back of the neck and upper middle region of the back, controlling the shoulder blade and the swinging movement of the arm. So when you swing your arms, you're using your Latissimus Dorsi. The Pectoralis Major and Pectoralis Minor are muscles of this chest assist in the swinging movement of the arm. So the Pectoralis Major and the Pectoralis Minor are, as you know, if you're an exerciser, and especially if you are a weightlifter and building your chest muscles, your pecs or Pectoralis Major and Minor are what most bodybuilders like to point out, the chest muscles. The serratus anterior muscles of the chest that assist in breathing and in raising the arm. The muscles of the shoulder and arm are the bicep, and that is the muscle producing contour of the front and inner side of the upper arm. It lifts the forearm and flexes the elbow. So that would be the underarm right here. The bicep of the arm bends the elbow and works in also as many muscles in conjunction with another muscle. One of those other muscles is the deltoid. That is the large triangular muscle covering the shoulder joint that allows the arm to extend outward and to the side of the body. And that would be this muscle right here. And you can feel it if you move your arm up and out. Again, weightlifters can feel this deltoid. Alright, the tricep is the large muscle that covers the entire back of the arm and extends the forearm. And the forearm is made up of a series of muscles and strong tendons. As a cosmetologist, we will be most concerned with the extensors, the flexors, pronators, and supinators. Okay, before I move on to those, I would like to show you the tricep. And when somebody thinks of, okay, I'm saying somebody, when I think of someone saying he's really got muscles, or she really, did you see the muscles on her, I'm thinking this muscle. Tricep, like Popeye's muscle, although he did have strong forearm muscles. Okay, moving right along to the series of muscles, and we will get into those in just 1 second. Hi, we're back, and now we're going to discuss the series of muscles that make up the muscles that a cosmetologist should be concerned with. They are the extensors, flexors, pronators, and supinators. And the extensors are muscles that straighten the wrist, hand, and fingers to form a straight line. These are the extensors, which makes sense. They extend. Okay, the flexors are the extensor muscles of the wrist, involving bending the wrist. Flexors. Pronators are the muscles that turn the hand inward so the palm faces downward. Those are the pronators. The supinators, yep, that's right. They're the muscles of the forearm that rotates the radius outward and the palm upward. Supinators. The muscles of the hand. The hand is one of the more complex parts of the body with many small muscles, and they overlap from joint to joint, providing flexibility and strength to open and close the hand and fingers. Important muscles to know include the abductors, the muscles that separate the fingers. Abductors separate the fingers. And the adductors, the muscles at the base of each finger that draw the fingers together. Adductors. They add them together. Abductors separate. Adductors add them together.